Top story this half hour. Around this time 3 years ago, if you can believe it, COVID-19 related shutdowns were just getting started. Of course, a lot's changed since then, including the virus itself.
So this morning, we wanted to talk with local researchers about those changes and also what is still to come. They've been tracking data since the pandemic began. ABC Action News reporter Larissa Scott is live near Tampa General Hospital with more on their findings for the future. Good morning, Larissa.
Hey, good morning, Diet. It wasn't that long ago, of course, that our local hospitals were filled with COVID-19 patients, but things look much differently now, and researchers are paying close attention to what that means for our future. It's now officially been 3 years since COVID-19 shutdowns started across the country. In that time, a lot has changed and attitudes about the pandemic have shifted. That's why USF researchers recently did a nationwide survey to check in with people.
The one important finding we get from the survey is that only 10% of respondents think that COVID-19 is still a high risk.
The survey also found that misinformation about vaccines is still widespread and that 1/3 of Americans are not confident in the safety of COVID-19 shots.
We found out only 50% of respondents think the children's vaccine is effective, is safe, and is necessary.
As researchers continue to track people's attitudes, health officials keep watching the numbers, although it's been hard to get an accurate picture of case numbers because of at-home tests.
So I look to wastewater data, and if we look since the beginning of 2023, by and large, we're seeing decreases in the extent to which COVID-19 is spreading in our communities. And
experts tell us this is a sign of progress and built-up immunity.
Even though people are still certainly getting COVID-19, the extent to which we're seeing severe illness thus far this year is just way lower, and hopefully that's a sign of things to come.
With each wave and variant, we're seeing less severe illness. Unless there's a new variant that comes with completely different mutations and characteristics, researchers predict we'll continue to see more of the same, but only if people keep getting vaccinated as new shots are released.
Because although we're looking pretty good right now, the immunity that we've built up from vaccination and prior infection, that will not last forever. And so we need to be mindful of how to best respond over time.
And while numbers are low right now, doctors stress that COVID-19 is not gone. People with high risk should not let their guards down. And there's a reminder, of course, that people are still dying. Reporting in Tampa, Larissa Scott, ABC Action News.